Hey, what's up guys, welcome back to another video. So cerebrovascular accident, more commonly called as brain stroke, is a very common condition which affects about 1 in 6 people in the world. It happens due to sudden cutoff of blood supply to the brain. Even though it's an acute medical condition, many people survive the initial acute onslaught and tend to live for many more years. There are a lot of changes which happen inside the brain of the person once the person has stroke. 100 or rather 50 years back, if you had to see these changes inside the brain of a person, you needed to cut open his skull, cut open his brain, and then you could appreciate these changes that happen inside the brain. But due to rapid advancements in radiology and imageology, you can now understand these changes and see these changes inside the brain of the patient without actually opening his skull or cutting his brain. So guys, welcome to this video where I tell you and show you the changes that happen inside the brain of a person after having stroke. So guys, this is our 3D specimen on which we will understand what actually happens inside the brain of a patient once he has stroke. Before I go into the details of the brain of this person, I want you to understand 3 terms which I will be using throughout this video. So guys, this view right here, when we are seeing the person from front, face to face, this is called a coronal view. And when we see the person or see the brain specimen through the side view, it is called a sagittal view. And the last but probably the most important one, and the one which we are going to see most of the time today, is going to be this view where we see the brain from a top down view. It is called an axial view. So once you have understood that, let us go to the brain specimen and try to understand what actually happens inside the brain of a person once he has stroke. So guys, just to make it clear to you, this is the skin of the patient. This is a volume rendered image, so you are able to see the patient's face. And we'll start removing structures one by one, and after removing the skin, the bones, now you end up with your brain and your eyeballs. So this is what your brain looks like. This view again, this view is the sagittal view. You are looking at the person's or specimen's brain from the side angle. And this is the coronal view where you are looking at it from the front. And the most important one, like I told you, is going to be this axial view where we are going to see the brain from a top-down view. So let's go into the brain. So this is your brain from a top-down view, that is the axial view. So starting off from the outside, the hyper or rather the bright structure that you see here is nothing but your scalp. It contains your skin, subcutaneous tissue and a deep tissue layer. So below the scalp is your skull bone, also called as the calvarium. So this is your skull bone, which is slightly whiter compared to the brain which is inside, but it is darker compared to the scalp because scalp contains fatty tissue which appears white on an MRI sequence. So this is your scalp, and this is your skull bone, and protected inside these two structures is your brain. So this is your brain from a top-down view, going from topmost position to the bottommost position. And these are your eyes and lens inside the eyeball. So to understand it more clearly, let us go in some detail to see what each structure is and what it actually means. So guys, once you start seeing the brain, you can appreciate that there are many projections or rather mountain-like structures inside the brain. These are called the gyri. And in between the gyri, there are few depressions that you can see. These depressions are nothing but your sulci. So your sulci and gyri are spread over the brain in such a manner that they keep alternating. So these are your gyri and the depressions are your sulci. And the two black structures that you see here are your lateral ventricles with CSF inside them. It's a fluid which is present inside your brain. And this fluid will keep replenishing the brain of its nutrients, and it will also remove the metabolites that keep forming due to the physiological process. So these are your ventricular system. These are your lateral ventricles. This is your third ventricle, and this is your fourth ventricle. This is the central sulcus which divides your brain into frontal lobe. That is the part which is anterior to the sulcus, this area. This is the frontal region of your brain which controls who you are. So it controls your personality, it controls your voluntary movement. So this is a very important region of your brain. And whenever there is a stroke or death of brain tissue at that region, it will lead to changes in the patient's personality and hemiplegia, unable to walk, unable to use his limbs. So that happens whenever there is a stroke involving the frontal region. Part of the brain is present posterior to this central sulcus. That is, behind the central sulcus is the parietal lobe. Again, parietal lobe forms a huge chunk of brain tissue, and it predominantly involved in controlling our perception of visual, perception of taste, and perception of other sensory activities. So apart from cerebrum, the other important structure present in the brain is going to be your brainstem. It is better seen in a sagittal view. So this is going to be your sagittal view, and this stem-like structure going from the brain to the spinal cord here is going to be your brainstem. So brainstem consists of three parts: midbrain, pons, and medulla oblongata. So let's go back to our axial view. So apart from cerebrum and brainstem, the other important organ here is the cerebellum, which again predominantly works as a fine-tuning mechanism. It controls all your voluntary actions and fine-tunes it. So whenever we learn any activity like riding a bicycle or swimming, initially it will be difficult for us to do these activities, but once you learn it, your brain automatically processes the information and you know what to do next. So that happens inside your cerebellum. It controls your gait, it controls your voluntary skilled activities. And this is the brainstem that we have seen in the sagittal view. So this is your medulla oblongata, the bottommost structure of the brainstem. And this is your pons, and as we go more superiorly, this is your midbrain. Your brainstem controls activities which are not under your voluntary control. For example, your breathing, your heart rate, your sympathetic and parasympathetic systems, which are not under your control directly. These systems are controlled by your brainstem. Therefore, it is a very vital organ, and any injury to brainstem leads to failure of these voluntary activities like failure of breathing, which is called as respiratory failure. So apart from these structures, another important structure that I want you to see is going to be your deep grey nuclei, that is your basal ganglia. So this is where your basal ganglia will be present. Again, this is the brain of a recurrent stroke patient. So you see a lot of bright dots in between. Those are lacunar infarct. More on this in the later part of the video. So this is your brainstem, and this here is your thalamus. So thalamus is like a relay station where all the sensory inputs from your body, they first come there and they stop in the thalamus, and from thalamus they project into the cerebrum, into the parietal and frontal lobes. So thalamus is also called as the sensory relay station of your body. So now let's understand what changes happen inside the brain of a patient after recurrent strokes. So the first thing that you can see here is that the left side ventricular system is bigger than the right, and there are less number of sulci and gyri on this side of the brain. This is the parietal lobe, left parietal lobe. There are less number of sulci and gyri. So what happened is, when the patient has a stroke, there is an irreversible neuronal death, and because of that there is decrease in the brain volume, and as a result of that the other cavity next to it will expand towards the dead area. Therefore, that is why you have a bigger lateral ventricle on the side of stroke than on the opposite side. So this patient had a large parietal stroke. This happens due to an MCA tertiary infarct. So he had a large parietal stroke and loss of many neurons here, leading to cell death of neurons and decreased volume, because of which there is a compensatory hyperinflation of the adjacent lateral ventricle. Apart from that, you can see many black dots inside the thalamus of the patient. These are relatively smaller in size compared to the big area that we see in the left parietal lobe. So these are nothing but your lacunar infarct. So whenever there are infarcts which are less than 2 cm or 1.5 cm in size, the medical terminology is a lacunar infarct. After 60-70 years, you tend to see this in many people. So this patient has lacunar infarcts in his thalamus and in his white matter of bilateral frontoparietal lobes, and there is a large infarct with volume loss in the parietal lobe. And this patient also has lacunar infarct of the brainstem in the pons region. So guys, this is the sagittal view of the patient. We are going from one side to the other. We are looking at it from a side-on view. So this is the cerebellum of the patient and this is the cerebrum of the patient. You can see the eyeball of the patient and this is the nose of the patient. So this is the perfect mid-sagittal view where you can see the cerebrum of the patient. This is the occipital lobe. This is the cerebellum of the patient, and this stem-like structure, if you consider this entire thing as a tree, then this would become a stem. So this stem-like structure is the brainstem. So this is the midbrain, this is the pons, this is the medulla oblongata, which continues down as the spinal cord. So brainstem connects your brain with the spinal cord. This is the nose of the patient, this is the oral cavity of the patient, and this is the scalp of the patient, and this is the skull bone of the patient, and this is the brain of the patient encased inside these two structures. Another important thing that I want you to see are going to be your blood vessels. So guys, there are two groups of blood vessels which supply the brain. There is the anterior circulation, which is formed by internal carotid arteries, and there is the posterior circulation, which is formed by vertebral and basilar arterial system. So guys, these two bright structures which you see as I scroll from bottom to top are your internal carotid arteries, which supply predominantly your anterior and middle part of your brain. So these bright structures are going to be your ICAs and branches of ICAs, like the anterior cerebral and middle cerebral arteries. The one which go towards the lateral side from ICA are the middle cerebral arteries, and the one which go anteriorly from ICA, these are going anteriorly. These are going to be your anterior cerebral arteries. Apart from the bilateral internal carotid arteries, the other system which supplies brain is the vertebral and basilar artery system. So here is the basilar artery, which has formed by the union of both the vertebral arteries, and as we trace this artery superiorly, we see that it divides into two arteries. That is the posterior cerebral arteries. As the name indicates, these supply the posterior part of the brain. So whenever there is a large occlusion of one of these arteries, there is a large area of brain that undergoes death, and there is compensatory volume loss and inflation of the adjacent ventricles. So this is again the image of the same specimen. We see that there are a lot of small white densities inside the brain. These are nothing but your lacunar infarcts, and there is a large area with volume loss of the adjacent brain, and there is a compensatory hypertrophy of the lateral ventricle. So this is a parietal lobe stroke with dilation of the adjacent ventricle. This is the thalamus with lacunar infarcts. This is the basal ganglia. This is the brainstem with lacunar infarct, and this is the cerebellum of the patient. So I hope this is clear to you what actually happens inside the brain of a patient once that patient has a stroke. So these changes can only be seen once you image the patient using a CT scan or an MRI. For you to see these changes 100 years back, it was impossible. So you had to cut open the patient's brain and then you have to see at the gross anatomy of the brain to understand these changes. But due to rapid advancements in imagology and radiology, we are now able to understand what actually happens whenever there is a stroke or any other damage to the brain. So if you found this video interesting, do hit the like button and do comment below what you want to see next. So do subscribe if you want to see more such videos where we try to see and understand what happens inside the human body during health and during disease.